Yes, sir.
Yes, am I audible to you? Everybody, are you listening to me?
Yes, sir, but the volume is low, sir.
Oh, volume is low. Okay, then I'll manage the volume. Just a minute. Okay, are you hearing me now?
Yes,
Am
sir,
I
it's
audible?
audible.
Okay. So in between, if there is any problem, please problem. Okay. Uh, so till now, the lower limb. Are you seeing the PowerPoint? I don't know, right? Are you seeing the PowerPoint?
Yes, sir, the PowerPoint is visible, but the voice is very much.
Voice is still low. Okay. Now is it okay? Is it okay now? Are you hearing? Hello.
Yes, sir.
Now it's okay. Are you hearing to me? Am I audible?
Yes, sir.
Okay. Okay. Nice. Then see till now you have finished the front of the thigh and what's next? Gluteal region of the lower.
You are muted.
Okay. I did unmute. Yeah. Now are you hearing to me? Okay. Are you hearing? Am I audible? Hello. Am I audible?
Yes, sir.
Okay. So today we'll start the back of thigh. Okay. And after we finish the back of thigh, we'll go into the popliteal fossa. So here in the diagram, you can see back of thigh starts from the gluteal fold. Yeah. Are you seeing the
Excuse me, sir.
crossword also? Yes, please. Yes, please. Here's the problem.
There is sound disturbance is occurring, sir.
Sound problem. Yeah.
Yes, sir.
Just a minute. Is it
Sir,
same
it's
again?
good to, sir, it's good to use. It's good to not to use that headset, sir.
Not to use this. Okay, then I'll remove it. Okay. Uh,
It's better now, sir.
okay, is it good now?
Yes, sir.
Okay,
Yes, sir.
good.
It's
Then
good.
I'll teach without using the headphone. All right. So the sound is clear now.
Yes, sir. Crystal clear.
Okay, very good, very good. So today we are doing the back of thigh at first, and then popliteal fossa. Okay. So first of all, I am showing you the extent of back of thigh in this diagram. So back of thigh extends from the gluteal fold. See, this one is the gluteal fold till to the knee joint. Yeah. Okay. This is the back of thigh. So this part is known as the back of thigh. So after knowing the extent, now we have to know the content of the back of thigh. What are the content here? I'm going into the next slide. Yes, there are the hamstring muscles in the back of thigh. Okay, the hamstring muscle includes two types. One is the true hamstring, and another is the modified hamstring. So under the true hamstring, you'll see two muscles: semimembranosus and semitendinosus. Okay, in the diagram also you can see the deeper muscle in the lower part. You can see this is the semimembranosus, and just superficial or backside of the semimembranosus, here you can see the semitendinosus. Okay, and modified hamstring are the long head of the biceps femoris. See here, this one is the long head of the biceps femoris. The lateral side you can see it. This one is the long head of the biceps femoris, and deeper here in the medial side there is the hamstring part of the adductor magnus. So these are the muscular content here under the hamstring muscle. Other than this, you can see short head of the biceps femoris also, deeper to long head. Later in the diagram I'll show to you. There lies the short head of the biceps femoris, and thick nerve, which you have seen before in the uh, gluteal region as well. Sciatic nerve also lies here in the back of the thigh, in the upper part. There is the sciatic nerve, and on the medial side of the sciatic nerve there is a thin nerve running with the sciatic nerve, is known as the posterior cutaneous nerve of thigh, or also known as the posterior femoral cutaneous nerve. This also lies here in the back of the thigh. Other than this, there is the chain of the vascular anastomosis on the surface of the adductor magnus. This vascular anastomosis, the longitudinal anastomosis lies there. This I'll show to you later in the diagram. Okay. So these are the content and description of this content today we are doing in the today's class. Okay, true hamstring, modified hamstring, you have to understand what are they at first, and then you have to know the origin, insertion of supply and action of all these hamstring muscles. All right, and then we'll study the nerves, okay, which are present there in the back of the thigh, arteries or the arterial anastomosis also we'll study, and then we'll study also the popliteal fossa, which we can see from the back side. Okay, this is behind the knee joint. So now come to the hamstring muscles. To be hamstring, there are the few criteria. So what are the criteria of the hamstring or the characteristic features of the hamstring? Yeah, I'm telling now. So hamstring, to be hamstring, the muscle take origin from the ischial tuberosity. Okay, so what is ischial tuberosity? Here you can see this is a part of the hip bone. Hip bone consists of the ilium, pubis, and the ischium. The lower end of the ischium is known as the ischial tuberosity. Here in the diagram you can see this one is the ischial tuberosity. Okay, ischial tuberosity, when you are sitting, see the ischial tuberosity touch the floor. Okay, it is a large bone, right? It is a large one. Here the red structure represents the ischial tuberosity. So to be the hamstring, muscle should take origin from the ischial tuberosity, and for the insertion, the muscle should insert beyond the knee joint. Okay, either in the tibia or into the fibula. In any bone it may insert. Okay, but it should cross the knee joint. All right. So after crossing the knee joint, where it should go? The muscle either to the tibia or to the fibula. And the hamstring muscle are supplied by the tibial division of sciatic nerve. Sciatic nerve, we already have studied it. It consists of the two divisions. Today also we are doing later on after the hamstring muscle, the sciatic nerve. It consists of the two divisions. One is the common peroneal nerve and there is the tibial nerve. So hamstring muscles are supplied by the tibial division of the sciatic nerve. And for the action, since the hamstring muscles are crossing the two joints, these muscles are acting in the two joints. See, they are acting as the flexor of the knee joint. Okay, here at the knee level, they are doing the flexion of the knee joint, and they are the extensor of the hip joint. Okay, they are the extensor of the hip joint and flexor of the knee joint. So these are the criteria to be the hamstring. All the hamstring muscles should satisfy this criteria. Okay, after this, see here. Yes, now come to the one of the member of the hamstring muscle, the semimembranosus. In the diagram you can see here, it is hiding deeper to the semitendinosus. Here in the lower part you can see this one is the semimembranosus. Okay, this muscle is the semimembranosus. So origin of the semimembranosus is from the superolateral part of the quadrilateral area of the ischial tuberosity. Here you can see ischial tuberosity. This one is the ischial tuberosity. It is colored with the different color to show the origin of the different muscle. So here this green structure, okay, green colored part represents the origin of the semimembranosus. Okay, it is from the superolateral part of the quadrilateral area of the ischial tuberosity. See, this ischial tuberosity at first divided into the two areas. Upper area is the larger area, which is the quadrilateral area. Okay, and lower area here is the smaller area, which is the triangular area. Right. So this quadrilateral area is further divided into the two parts. One is the superolateral area and other is inferomedial area. So this one is the inferomedial area and this one is the superolateral area. Here you have to remember this semimembranosus muscle origins from the superolateral part of quadrilateral area of the ischial tuberosity. Okay. Now come to the insertion. Insertion is, see, after the origin the muscle is descending downward. It crosses the knee joint, okay, and inserted into the horizontal groove which is lying on the posterior surface of the medial condyle of tibia. Tibia is a bone of the leg, okay. It's a long bone. It consists of the upper end, shaft and the lower end. In the upper end, which is forming the knee joint, okay, there are the condyles. There are two condyles, medial condyle and the lateral condyle. On the posterior surface of the medial condyle, there is a groove. Okay, there is a groove, horizontal groove. Yes, in this group there lies the insertion of the semi-membranous osseous. So insertion is on the horizontal groove on the posterior surface of the medial condyle of the tibia, and its nerve supply is the tibial part of the sciatic nerve. All the hamstring, true hamstring, are supplied by the sciatic nerve. So, which part? Tibial part. All right. So that semi-membranous is also supplied by the tibial part of the sciatic nerve. Now come to the actions. What are the actions of this muscle? Before also I have said all the hamstrings are the flexors of the knee joint, so semi-membranous also flexor of the knee joint, and all the hamstrings are the extensor of the hip joint, so semi-membranous is also the extensor at the hip joint, because semi-membranous is a hamstring muscle, isn't it? And it is also doing the medial rotation of the leg, okay, at semi-flexed knee joint. It is also doing the medial rotation of the leg at the semi-flexed knee joint, okay. So here you have to remember it is a flexor of the knee joint, extensor of the hip joint, and when you are doing the semi-flexion of the knee joint, that time it is doing the medial rotation of the leg. It is rotating the leg medially. Medially means inward rotation. All right. So after this, come to another muscle of this hamstring group is the semitendinosus. Here in this diagram, you can see this one is the semitendinosus muscle. Deeper muscle is the semimembranosus muscle. Just now we have finished the explanation of this. Now this one is the semitendinosus muscle. It is superficially placed. Okay, after doing the incision of the skin and the deep fascia, you can immediately see the semitendinosus muscle on the medial side of the thigh. All right. So this one is the semitendinosus muscle. So origin of the semitendinosus muscle is from the inferomedial part of the quadrilateral area of ischial tuberosity. Before, for the semimembranosus, I have told you the superolateral part of the quadrilateral area. Here in the diagram, again taking you into this ischial tuberosity. So this purple color represents the origin of semitendinosus along with the long head of the biceps femoris. So this area is the origin of the semitendinosus and the long head of the biceps femoris. They are originating together. Okay, there is common tendon for the origin of the semitendinosus and the long head of the biceps femoris. So here superiorly, this is the origin of the semimembranosus. Inferior to semimembranosus, this part is the origin of the semitendinosus and the long head of the biceps femoris. Okay. Now insertion is upper part of the medial surface of the tibia, behind the insertion of the sartorius and gracilis. Here you can see tibia in this diagram. This one is the tibia, this one is the upper end of the tibia. Okay, this one is the femur. Femur is the bone of the thigh, and tibia, fibula, these are the bones of the leg. So this one is the upper end of the tibia. And here this is the medial surface of the tibia. Medial means inner side of the tibia. Okay, inner surface of the tibia. Here in the upper part of the medial surface of the tibia, you can see insertion of the many muscles. Sartorius is there, gracilis is there, and behind the gracilis there lies the insertion of the semitendinosus. Okay, so here this point is for the semitendinosus. So first of all, what is this? Is a muscle of the front of the thigh. You must have studied before. Gracilis. This is the muscle of the medial side of the thigh. This also you must have studied before. And today you are doing the semitendinosus. After the gracilis, what is there? There is the semitendinosus. To represent the insertion of these three muscles, there is a mnemonics. It is said say graze before T. Say yes, start from the yes. Says means start from the yes. So this represents the sartorius. Graze means starts from the G. So this represents the gracilis. Before T, T means semitendinosus. These two are lying anterior to the semitendinosus. First of all, there is insertion of the sartorius, then gracilis, and there is insertion of the semitendinosus on the medial aspect of the upper part of the tibia. Okay, these three insertions are forming the like ropes. Okay, they are pulling the tibia upward from upper directions. All right. So this one is the insertion of the semitendinosus. Now come to the nerve supply. It is same, tibial part of the sciatic nerve. Action also same, similar to the semimembranosus, because semitendinosus also the member of hamstring group of the muscle. So the actions are easily you can say now flexor of the knee joint, extension at the hip joint, and medial rotation of the leg at the knee joint when the knee joint is semi-flexed. So these are the actions of the semitendinosus. Now come to the another component of the hamstring group of the muscle, but not entirely. The biceps femoris is hamstring. It consists of the two parts. One is the long head, other is the short head. Okay, the long head represents the uh, hamstring group of the muscle, but not true hamstring. It is the modified hamstring. Okay, so long head and short head. These are the two heads of the biceps femoris. Here you can see biceps femoris. This one is the long head of the biceps femoris. In the back of the thigh, the biceps femoris lies on the lateral part of the thigh. Okay, so long head origin from the inferomedial part of the quadrilateral area of the ischial tuberosity along with semitendinosus. Short head is originated from the lower part of the lateral lip of the linea aspera and upper two-thirds of the lateral supracondylar line of femur. Here I think this word is new to you, linea aspera. If you have done the osteology of the femur, then you must have heard this word, linea aspera. So linea aspera is the posterior border of the femur. Okay, linea aspera is the posterior border of the femur. It is very sharp. It consists of the two lips and on intermediate area, medial lip, lateral lip. Okay, and in between the two lips there is the intermediate area. So this is the part of the posterior side of the femur, linea aspera. So the short head origins from the lower part of the lateral lip of the linea aspera and also from the upper two-thirds of the lateral supracondylar line of femur. Supracondylar line, this is also part of the femur. So supracondylar line means see in the femur lower in there are the two condyles, medial condyle and the lateral condyle. Superior to the two condyles, you can see two lines are converging to form the linea aspera. Okay, the medial line is known as the medial supracondylar line and lateral line is known as the lateral supracondylar line. So this short head of the biceps femoris origins from the upper two-thirds part of the lateral supracondylar line of the femur. Okay. Now see after the origin from the two different sides, the two belly from the common tendon. See here inferiorly this forms the common tendon of the biceps femoris. This white part is the tendon of the biceps femoris. Laterally you can see tendon of the biceps femoris. Medially you can see semimembranosus and superficially in the medial side you can see semitendinosus. So these two muscles are lying medially and this muscle biceps femoris is lying laterally. So this tendon goes down and insert into the head of the fibula. See here inferior to the knee joint. See this is the level of the knee joint. You can see two bones. This one is the tibia and this one is the fibula. So a fibula consists superiorly the head. This one is the head of the fibula. After the head there is the neck of the fibula. Then there is shaft of the fibula. So this tendon inserted into the head of the fibula. This is the insertion of the biceps femoris. Okay. Now come to the nerve supply. Long head is the hamstring muscle. Okay. So this is inserted into this is supplied by the tibial part of the sciatic nerve. Short head is not a hamstring muscle. Okay, because see, it is supplied by the anther nerve, common peroneal part of the sciatic nerve. So two heads are having the two different nerve supply. Long head supplied by the tibial part of the sciatic nerve. Short head supplied by the common peroneal part of the sciatic nerve. Now come to the actions. Flexion of the knee joint, extension of the hip joint, and lateral rotation of the leg at the semi-flexed knee joint. So this is present, or this is lying laterally. Okay, this is lying laterally. This is lateral muscle. So this is doing the lateral rotation. Other two muscles before which we have studied semimembranosus and semitendinosus. These are lying on the medial side. Okay, so they are doing the medial rotation of the leg, and the knee is semi-flexed. Since this biceps femoris is lying on the lateral side. Okay, it is present laterally. So this is doing the lateral rotation outward rotation. Lateral rotation means outward rotation of the leg. You can try these different types of the movements of my class. You can try. You can try the flexion at the hip joint, extension at the hip joint, flexion as well as extension at the knee joint, lateral rotation, medial rotation, adduction, abduction. All these movements you have to try along with the study of these muscles. Okay, then it will be easier to understand as well as to remember the actions of the muscles. So after these muscles, now I'll come to you. Any doubts to understand the origin, insertion, nerve supply, and action of these three hamstring muscles? You can ask now. Okay. After clarifying your doubts, now I'll enter into the arterial anastomosis at the back of the thigh. Any doubts?
Can you please explain the semitendinous?
Yes, semitendinosus. Okay, I'll go to the diagram. I'll speak with the diagram. See here, semitendinosus. This is the semitendinosus muscle. Okay, and this is the biceps femoris muscle. First of all, you have to know the position of this muscle. All these muscles we are describing today, which are lying in the back of the thigh. You have to imagine these muscles in the back of thigh. Okay. So this semitendinosus lies in the medial side or medial part of the back of thigh. Medially you have to imagine. Biceps femoris lies in the lateral side of the thigh. Now see, this is called semitendinosus because see, its lower half represents tendinous. Okay, lower half is tendinous. See here, lower part is tendinous. Upper part is belly. Okay, muscular, and lower part is more tendinous. So that it is known as the semitendinosus. Meaning of semitendinosus means half part of the muscle is tendinosus. It's like tendon. Half part of the muscle is tendon. So it is known as the semitendinosus. And before I have explained the semimembranosus. Why it is called semimembranosus? The half part of the muscle is membrane. Upper half is membrane in case of the semimembranosus. In case of semitendinosus, lower half, even though in the diagram it showed small part tendon, the lower half. In reality, in the dissection in body, you can see lower part, lower almost half part of this muscle is tendinosus. So that it is known as the semitendinosus. And its insertion origin is from the ischial tuberosity. Which part of the ischial tuberosity? All these hamstring muscles are originated from the ischial tuberosity. This is the concept of the hamstring muscle. Before also I have told in the criteria of the hamstring must origin from the ischial tuberosity. So semitendinosus origin from the ischial tuberosity as well. But which part of the ischial tuberosity? This you have to specify. This is from the inferomedial. Okay, any doubt? Anybody speaking?
Yes, sir.
Yes, this is from the inferomedial part of the quadrilateral area of the ischial tuberosity. Yes, so this is the origin. This is the origin of the semitendinosus. Now insertion is into the tibia. Tibia, I have told you one mnemonic. Say graze before T. First of all, there is insertion of the sartorius. Then there is insertion of the gracilis. Okay. Then there is insertion of the semitendinosus in the medial surface of upper part of the tibia. There is insertion of the semitendinosus. So is it clear to you now?
Yes, sir.
Okay. Any other doubts to anybody you can ask regarding these muscles? Any person want to ask? Please ask. Everybody there? Can I just check some of you? Like Supriya is there? Roll number 68. Supriya, are you there listening to me? She is not there. So I'll mark the absent if you are not responding. Okay. And then Naveen Bhandari, are you there? Naveen, can you respond? Naveen also not there. Supriya also not there. Ranjan, are you there? Roll number 99.
Yes, sir.
Yes, Ranjan Yadav. Are you
Yes,
hearing
sir.
to me?
Yes, sir.
Any doubts? Any confusion?
No, sir.
Can you tell me one feature of the hamstring muscle? Out of many, I have told you many. You remind me one feature. You tell me one feature of the hamstring muscle.
All of them origin from the ischial tuberosity.
Very good. All of them origin from the ischial tuberosity. Very good. Any other you can share with your friends?
They need to go beyond the knee joint for the insertion.
Yes. They should go beyond the knee joint, and insertion must be either into the tibia or into the fibula. Very good. And another point. What is the other point? To be
I
hamstring.
couldn't recall, sir.
Yes, should be
Sorry,
supplied
sir.
by the tibial. No problem. You have answered the 2 points. That's enough. Okay. Thanks a lot. So another point I'll tell to you, they should supply by the tibial component of the common peroneal nerve. Okay. And another point
Okay,
I'll
sir.
add again, they are the flexor at the knee joint. Flexor means bending the knee joint, and extensor at the hip joint. These are the 4 points. You can write only the 4 points. This question is very important question for your examination. Okay, mention the characteristic features or the criteria to be the hamstring. Always we are asking in the examinations. Okay, so remember these 4 points. All right, now after this brief discussion, now we'll enter into the arterial anastomosis at the back of the thigh. See in this diagram, you can see the anastomosis among different branches of different arteries. So this is known as the arterial anastomosis at the back of thigh. So you have to know the location. You have to explain the location. This anastomosis lies on the posterior surface of the adductor magnus. This muscle is adductor magnus. This muscle is adductor magnus. Okay. So how it is formed? It is formed by the anastomosis between the ascending and descending branches of 4 perforating arteries. These perforating arteries, see here, this is first perforating artery, this is another perforating artery, this is another perforating artery, and this one is the other perforating artery. These perforating arteries are the branches from the profunda femoris artery. Profunda femoris artery, if you do not forget, you must have studied in the front of the thigh. This is a larger branch of the femoral artery, isn't it? In the femoral triangle, you must have studied the branches of the femoral artery. So profunda femoris artery is a branch from the femoral artery origin within the femoral triangle. So this profunda femoris artery gives 4 perforating branches. 4 perforating branches. Why they are called perforating branches? Because they pierce the adductor magnus. Adductor magnus. This one is the adductor magnus. Okay. So they pierce all the 4 branches pierce the adductor magnus. So they are known as the perforating branches. Perforating means piercing. Okay. So this one is the first perforating artery, this is second, this is third, this is fourth. And this perforating artery, each perforating artery gives 2 branches. One is ascending branch and that is descending branch. First gives 2 branch, second gives 2 branch, ascending, descending. Third gives 2 branch, ascending, descending. Fourth gives another 2 branch, ascending and descending. Now these branches join to each other. Okay, join to each other to form a continuous arterial structure. This joining is known as the anastomosis. Here in the diagram you can see the branches are anastomosing to each other to form continuous arterial structure. Here lying on the posterior side of the adductor magnus. Okay, and this anastomosis is supported from the superior side by the inferior gluteal artery. See here, this one is the branch from the inferior gluteal artery. This is branch from the inferior gluteal artery. This is also anastomosed with the ascending branch of the first perforating artery. And this is supported, okay? This is supported or completed from the inferior side by a branch from the popliteal artery. See here, this one is the popliteal artery. So a muscular branch from the popliteal artery ascends up and anastomosed with the descending branch of the 4th perforating artery to complete this anastomosis. Okay. So what is the importance of this anastomosis? Its importance is, see, sometimes there will be some ligation or some thrombosis in the some part of the profunda femoris artery. Okay, in the anteriorly before giving first perforating branch. If there is thrombosis in the profunda femoris artery, then this perforating branch will not get blood from the profunda femoris artery from the anterior side. Okay, but see, this time there will be circulation of the blood either from the upper artery here, intragluteal artery, or from the popliteal artery here to supply the blood to the posterior side of the thigh. So this is the benefit of this anastomosis. This anastomosis establishes the collateral circulation, okay, to supply the nutrition or the blood to the different structures, okay, here in the posterior side of the thigh, muscles as well as other structures also. So this is the importance of this anastomosis, and superiorly see the upper part of this anastomosis forms the cruciate anastomosis. See here, this part is known as the cruciate anastomosis. Okay, see this longitudinal anastomosis continues superiorly or participate superiorly to form the cruciate anastomosis. This supplies the structures around the upper end of the femur. Okay, so yeah, this one is the cruciate anastomosis. So this one is the anastomosis which is present in the back of the thigh. Now come to the sciatic nerve. This nerve in the gluteal region also it was taught. So I'll quickly go into this nerve. I'll interact more with this about this nerve. What is the nerve supply root value of this nerve? Sciatic nerve. Huh? Sulabh is there. Rule number 92. Hello Sulabh, are you there? Sulabh also will be marked absent if you are not responding. Sulabh, are you hearing? Vimala,
Yes,
are you
sir.
there? Okay, Sulabh is there. Okay, your roll number is 92, isn't it? Huh?
Yes, sir.
Okay.
Yes, sir.
So, what is the root value of sciatic nerve? In the gluteal region also it was taught. Okay. So, what is the root value of sciatic nerve?
Number
Yes.
number 2, 3, and
No, sciatic. L4, L5. See there in the screen. Are you seeing the screen or not? It is showed there.
Sir, the slides is hanging, sir.
Oh, hanging. Okay, then also you have to know because it is taught already. So you revise after teaching. You revise. Okay. So its root value is L4, L5, S1, S2, and S3 from the sacral plexus. L4, L5, S1, S2, S3. So this is taught before. So I am not wasting more time here. Even the course of the sciatic nerve on the gluteal region also taught yesterday, I think. Okay. So after the gluteal region, see nerve is passing straight down. Now you can unmute your mic. Mute your mic. Sulabh, you can mute your mic. Okay, and listen to me. So after coursing here on the within the gluteal surface, see it passes straight downward, resting on the resting deep to the long head of the bicep femoris. See here, this one is the bicep femoris. This nerve lies deep to the bicep femoris here in the posterior side of the thigh. You see the sciatic nerve, this thick nerve, this is the thickest nerve of our body. Okay, this nerve lies deeper to the long head of the bicep femoris in the posterior side of the thigh and rest on the adductor magnus. And then this nerve related medially with the semimembranosus. Medial to this nerve, you can see semimembranosus and the semitendinosus muscle. And lateral to this nerve, you can see this one, biceps femoris muscle. So this is lying in within the two group of the muscle. Two group means like a region wise, a medial group and the lateral group. Okay, in the posterior side. After this, it will reach at the upper angle of the popliteal fossa. See here, this is the popliteal fossa. It will reach here at the upper angle of the popliteal fossa and divides into the two branches. Okay. The medially going branch is the tibial nerve and laterally going branch is the common peroneal nerve. This one is the tibial nerve, the straight one, which is lying medially on the medial side is the tibial nerve, and the one which goes laterally, okay, thinner one and obliquely passing one, okay, is the common peroneal nerve. This one is the common peroneal nerve. Okay, so these are the two terminal branches of the sciatic nerve. After this, you have to know some of the branches within the thigh of the sciatic nerve. So what are the branches? From the medial side, yes, tibial nerve, terminal branch, and from the tibial component you can see muscular branches to the semitendinosus, muscular branch to the or motor branch to the semimembranosus, also to the long head of the biceps femoris, okay, and hamstring part of the adductor magnus. So this is lying on the medial side. This is medial part of the sciatic nerve, okay. And from the lateral part of the sciatic nerve, Okay, there comes the common perennial nerve, and this component gives the one branch. This one is the short head of the biceps femoris. Okay, motor branch to the short head of the biceps femoris. So after these branches, now I'm taking you into this some of the applied part of this common perennial nerve. The injury of sciatic nerve may cause by the penetrating wounds or by the posterior dislocation or the fracture of the hip. Okay. After the injury of the sciatic nerve, there will be following results. All the muscles below the knee will be paralyzed. Okay. All the muscles below the knee will be paralyzed because all the muscles below the knee are supplied by the branches from the sciatic nerve. Okay, so these muscles will be paralyzed either from the tibial component they are supplied or from the common perennial component they are supplied. And since both the nerves are branched from the sciatic nerve, so if there is injury to the sciatic nerve, so branch coming from the tibial as well as common perennial also will not work. They will be paralyzed. Okay, and there will be foot drop. Foot drop means see, this is when there is injury to the common perennial nerve at the lower level or the at the higher level to the sciatic nerve completely, then there will be foot drop. Foot drop means the foot is going down, plantar flexed. Okay, this is known as the foot drop. Foot is suspending down at the ankle joint. Okay, plantar flexed. We cannot do the dorsiflexion because of the injury to this common perennial nerve or the sciatic nerve at the higher level. There will be paralysis of the extensor muscles of the uh, leg, which are doing the dorsiflexion of the foot. So if the dorsiflexors are paralyzed, then there will be foot drop. Okay, and all cutaneous sensation below the knee are lost except area supplied by the saphenous nerve, because this nerve also gives the cutaneous branch. So they are also cutaneous sensation below the knee are lost. Okay, and the compression of the sciatic nerve against femur results the slipping foot, and sometimes there will be sciatica. This result the shooting pain along the cutaneous distribution of the sciatic nerve and its terminal branches. So these are the applied part of this nerve. Now I'm taking you into the and the part popliteal fossa. Any doubt here in this nerve? Since this nerve was talked before also in the gluteal region, so I have quickly gone through this nerve. Any doubt you can ask? Anybody you want to share, ask some doubts? They have to focus here two terminal branches of the sciatic nerve, common perennial nerve and the tibial nerve. Okay, and you have to focus here into the muscular branches from the tibial component of the sciatic nerve. They are supplying to the semitendinosus, semimembranosus. Okay, and long head of the biceps, popliteal, and yes, popliteus, and then what else? Here in this slide I have showed to you. Yes, adductor magnus. So yes, these are the branches from the tibial component, and from the common perennial component there is branch to the short head of the biceps. So all these things you have to remember. Okay, now come to the popliteal fossa. Popliteal fossa is a diamond shaped fossa behind the knee joint. See here, this one is the level of the knee joint. Okay, in the posterior side of the knee joint you can see deep depression which is diamond shape. This is known as the popliteal fossa. You can easily feel it. You can do it now also. Okay, just feel behind your knee joint. Just feel behind your knee joint. There is some depression. If you trace this depression superiorly and inferiorly, then this gives us shape. This shape is the diamond shape. Have you traced, some of you? Huh? Saurabh, are you there? 87?
Sir.
Yes. Have you feel your this popliteal fossa?
Yes, sir.
Okay. So there is some depression behind the knee joint, isn't it?
Yes, sir.
Yes. This is known as the popliteal fossa. Okay. So everybody must understand first of all where it is located. Aryan is there. Aryan, yes. Roll number 77. Hello, Aryan. Aryan is not there. Shivang Sagar, are you there? He is also not there. Ujjal Sapkota, are you there?
Yes, sir.
Have you felt your popliteal fossa?
Yes, sir.
Where have you felt? Behind side or front side of the knee joint?
Behind side of the knee joint, sir.
Yes, yes, there is a depression. This is known as the popliteal fossa. Good. Okay, then see, I have to tell you the boundaries content of this popliteal fossa. Now I am taking you to this part. Okay, so it is a diamond-shaped space behind the knee joint. Okay, the boundaries you have to know. Superomedially, there is the semitendinosus and semimembranosus muscles. See here, this is the superomedial boundary. This is the superolateral boundary. This is the inferomedial boundary, and this one is the inferolateral boundary. This space is the popliteal fossa. Okay, so superomedially, there is the semitendinosus, superficially semitendinosus, and deeper to the semitendinosus there is the semimembranosus muscle, and superolaterally this one is the tendon of the biceps femoris muscle. Okay, superolaterally, this is lateral side, this is medial side. So superolaterally this is the tendon of the biceps femoris muscle. Inferomedially there is medial head of the gastrocnemius, and inferolaterally this is the lateral head of the gastrocnemius. Along with this there is a small muscle in this diagram, you can see deeper small muscle along with the lateral head of the gastrocnemius is the plantaris. So this one is the plantaris. So these are the boundaries: superomedial boundary, superolateral boundary, inferomedial boundary, and lateral boundary. Now come to the floor. Floor is formed by the different structure. Here from above downward, I am showing you the structures forming the floor of the popliteal fossa. Superiorly, there is the popliteal surface of the femur, this bony part, and then capsule of the knee joint, this white part, and this is the oblique popliteal ligament. Okay, this oblique popliteal ligament is the extension of the tendon of the semimembranosus. This also you have to note down here. After insertion of the semimembranosus on the posterior side of the condyle of the femur in its groove to the semimembranosus, the tendon extends. See, this is the tendon of the semimembranosus. After its insertion here in the posterior side of the medial condyle of the tibia, the tendon extends laterally, lying behind the capsule of the knee joint. This extension is known as the oblique popliteal ligament. So this one is the oblique popliteal ligament. And then there is the posterior part of the upper end of the tibia. See here, this is the posterior part of the upper end of the tibia. And then there is fascia covering the popliteus muscle. This muscle is the popliteus muscle. This is covered by fascia. Okay, this also forms the floor of this popliteal fossa. And this floor is pierced by the middle genicular vessels, middle genicular nerve, and genicular branch of the posterior division of the obturator nerve. So these are the structures piercing the floor of the popliteal fossa. Now come to the roof of the popliteal fossa. Roof is also known as the posterior wall. Roof is formed by the strong popliteal fascia. The deep fascia in this region is known as the popliteal fascia, which is a strong seat. Okay, so this forms the roof, and outside the deep fascia there lies the superficial fascia. Okay, similar to the other region, here also there lies the superficial fascia, and within this superficial fascia you can find the posterior cutaneous nerve of the thigh. See here, this one is the posterior cutaneous nerve of the thigh, and posterior division of the medial cutaneous nerve. See here, this one is the posterior this one is the posterior division of the medial cutaneous nerve of the thigh. Okay, and then in lateral side you can see peroneal sural communicating nerve. This one is the peroneal sural communicating nerve. Other than this, this roof is pierced by the small saphenous vein. This one is the small saphenous vein, and by the posterior femoral cutaneous nerve, which also piercing the roof. So these are the structures which you can see in the roof. Come to the content of the popliteal fossa. Within the popliteal fossa, you can find the popliteal artery and its branch. See, this red structure is the popliteal artery. Okay, and its branches also there. Popliteal vein. This blue structure is the popliteal vein, and its tributaries are also there. And this one, the straight structure, the yellow one, is the tibial nerve. Okay, and its branches are also there. Common peroneal nerve, the laterally obliquely going structure here. The yellow one is the common peroneal nerve, and its branches are also there. Termination of the saphenous vein also you can see here. In this diagram it is not showed, but small saphenous vein, not the great saphenous. Termination of small saphenous vein also lies here. And posterior femoral cutaneous nerve, which already I have showed you in the roof within the superficial fascia. And genicular branch of the posterior division of the obturator nerve also you can see. This is a small one, so it is not showed in the diagram. Okay, and popliteal lymph nodes are also there. Okay, and there is adipose tissue also within the popliteal fossa, bed of the fatty, you can say. Okay. So after this, now you have to know the relation of the neurovascular bundle which is lying there within the popliteal fossa. So it is divided into the three parts: upper part, okay, middle part, and the lower part. So in the upper part, see here, diagram is enough to explain the relation of all the three structures. Neurovascular structures means all these three structures: popliteal artery, popliteal vein, and the tibial nerve. Okay, the popliteal artery is a continuation of the femoral artery. Same artery continue downward into the popliteal fossa, known as the popliteal artery. Okay. According to regions, the arteries are changing their name. So here, same artery is known as the popliteal artery. So red structure is popliteal artery, and this blue structure is popliteal vein. Popliteal vein superiorly continue as the femoral vein, and this tibial is a branch of the sciatic nerve. Upper part, in the middle part, and in the lower part. So in the upper part, from medial to lateral, you have to check from medial to lateral. From medial side means this is medial side, this is lateral side. Medial to lateral, you can see first nerve, and then vein, and then artery. Okay. Now come to here in the middle part. In the middle part, anterior to posterior, you have to remember. Here from medial to lateral, here from anterior to posterior. Okay. Anterior to what is there? Artery, and then vein, and again the nerve. Same relation, but here anterior to posterior. And now come to here into the lower part. Lower part, you have to check from lateral to medial. Okay, same relation. Lateral, this is lateral, sorry, this is lateral, and this is medial. Laterally there is artery, okay, there is vein, and there is nerve. So these facts you have to remember here. Everywhere there is artery, vein, nerve, artery, vein, nerve, artery, vein, nerve. But what is the sequence? This you have to remember. Okay, here in the upper part, medial to lateral, artery, vein, nerve. In the middle part, anterior to posterior, artery, vein, nerve. And in the lower part, what is there? Lateral to medial, artery, vein, nerve. So remember this relation within the popliteal fossa, very, very important for your examination. We'll ask the relation of the neurovascular structure within the popliteal fossa. Okay. After this, now a little description about these structures which are present there in the popliteal fossa. First of all, the popliteal artery, already told. Popliteal artery is the continuation of the femoral artery from the fifth osteoaponeurotic opening of the adductor magnus. What is this fifth osteoaponeurotic opening? So in the adductor magnus, already you have seen the four opening for the four perforator. Okay. Now this fifth or the last opening is for the passage of the femoral artery into the popliteal fossa. Okay. So osteoaponeurotic opening, it is known as the popliteal artery. Right. So this one is the popliteal artery. Now this is the fifth osteoaponeurotic opening. Now its course it runs inferolaterally. It is going a little laterally. Okay, from medial side it's going to the lateral side, and terminates at the lower border of the popliteus. See, this muscle is the popliteus. It reaches till to the lower border of the popliteus, and here it terminates and gives two terminal branches. So what are the two terminal branches of the popliteal artery? The anterior tibial artery and posterior tibial artery. See here, the anterior tibial artery goes anteriorly into the anterior compartment of the leg, and this one is the posterior tibial artery which supplies the posterior compartment of the leg. Now, what are the branches of popliteal artery? Okay, there are cutaneous branch, muscular branch, and articular branch. Among them, you have to remember the articular branch, also known as the genicular branch. Okay, there are the 5 genicular branch. They are the superior medial genicular artery. Okay, here you can see this is the superior medial genicular artery. Here, this one superior medial genicular artery. This is inferior medial genicular artery. Okay, here also you can see superior medial, inferior medial genicular artery, and this is the superior lateral genicular artery, and this is the inferior lateral genicular artery, and in between here in the in between here you can see middle genicular artery. Okay, and terminal branches are the anterior and posterior tibial arteries. Already I have told you. Now come to the tibial nerve. Root value of the tibial nerve is ventral division of the ventral rami of L4, L5, S1, S2, and S3. Similar to the sciatic nerve, because this is a branch of the sciatic nerve, and this is the thicker branch in comparison to common perennial nerve. So it is getting all the root value similar to the sciatic nerve. Okay, root value is L4, L5, S1, S2, S3. But here you have to remember which division? Ventral division of ventral rami of L4, L5, S1, S2, S3. Now see the course of the tibial nerve. Tibial nerve runs vertically downward along the midline of the popliteal fossa from the superior angle, of the popliteal fossa to the inferior angle of the popliteal fossa. Okay, and lies superficial to the popliteal vessel. Here you can see it is lying superficial to the popliteal vessel. Okay, outside the popliteal vessels. In the upper part, it lies lateral to the vessel. See here, it is lying laterally in the upper part. And the middle part, it is superficial to the vessel, and in the lower part, it is lying medial to the vessels. In the lower part, overlapped by the gastrocnemius. See here, the gastrocnemius hairs are cut. Okay, in the lower part, this nerve is overlapped by the gastrocnemius and enters into the back of the leg. It is going there into the back of the leg, passing under cover of the tendinous origin of the soleus. This muscle is soleus, and this white part is the tendinous origin of the soleus. This pierces the tendinous origin of the soleus and enters here into the back of the leg to supply to the back of the leg. Here you can see tibial nerve is going there down into the back of the leg.